You know, your body has this incredible, super sophisticated system for managing its water balance. It's happening every second of every day, silently, just keeping you alive. But what happens when that one critical signal that controls the whole operation just gets lost? Today we're going to do a deep dive into exactly that. We're talking about arginine vasopressin deficiency, or AVPD, a condition where the body's water management system basically goes offline.
So here's the game plan. We'll start by understanding how the system is supposed to work. Then we'll look at what happens when it breaks, how doctors figure out what's wrong, how they fix it, and finally, what it really means to live with this condition. It's a journey from start to finish.
All right, first things first. How does this all work when everything is running perfectly? I mean, the body's ability to manage water is nothing short of a biological masterpiece.
Okay, let's meet the star of the show. This molecule right here, arginine vasopressin, or AVP for short. You can just think of it as the body's master water saver. Its whole job, its entire purpose, is to be a messenger that tells your kidneys, hey, hold on to some water, we need it.
And check out how beautifully simple this system is. It all starts in the brain's hypothalamus. Think of it as the control center, and it is constantly sampling your blood. If things get a little too concentrated, maybe you're dehydrated, it sends an alert to the pituitary gland. The pituitary then releases our AVP messenger into the bloodstream. AVP travels all the way to the kidneys, which are kind of like the body's dam, and delivers the order, save water. The kidneys listen, they reabsorb water back into the body, and just like that, your blood balance is restored. So elegant, right?
So, that's how it's supposed to work. But what happens when that crucial messenger, AVP, never even gets sent from the control center in the first place?
Well, that brings us to arginine vasopressin deficiency. And here's the key thing to get. The problem isn't with the kidneys. They're totally fine. They're ready to follow orders. The problem is the orders never arrive. The control center in the brain fails to send the signal, so the kidneys, with no instructions to save water, just let it all flow right out.
So why would this signal suddenly go missing? Well, the most common reason is some kind of physical damage, a serious head injury, or very often after surgery on the pituitary gland. But as you can see, there's a whole list of other culprits. It could be tumors, inflammation, a genetic issue, or sometimes, and this is really frustrating for everyone, doctors just can't find the cause. Now, this is a really fascinating and frankly tricky situation that doctors have to manage. After an injury to the pituitary, the body can go on this wild three-phase roller coaster. First, right after the injury, the AVP signal stops, poof, so you lose a ton of water. But then, the damaged cells start leaking out all their stored AVP, which causes the exact opposite problem. The body holds on to too much water. And finally, once all those stores are used up, the permanent deficiency kicks in. You can see how this would be really confusing to manage without knowing this pattern. Okay, so we've got the mechanism down, but what does this actually look and feel like for a patient? What happens when the kidneys just let the floodgates open?
Well, it really boils down to this classic triad of symptoms. First up is polyuria. That's the production of massive amounts of very watery, dilute urine, all because the kidneys aren't reabsorbing water. That leads directly to polydipsia, this intense, relentless thirst as the body is just screaming to replace all the fluid it's losing. And of course, the combination of those two leads to nocturia, waking up and over and over and over again at night to go to the bathroom.
And when we talk about a lot of urine, we're not kidding. To get a clinical diagnosis of polyuria, an adult has to be producing 3 or more liters of urine every single day. Just think about that. Imagine trying to keep up with that level of fluid loss. It's completely life-disrupting.
So the symptoms are pointing to a major issue with water balance. But lots of things can cause excessive thirst. This is where the real detective work begins for doctors. How do they find the exact point of failure in the system?
This right here is the central question they need to answer. Is the brain failing to send the AVP signal? Or is the brain sending the signal just fine, but the kidneys are completely ignoring it? It's a critical distinction to make.
And here's the breakdown. With AVPD, the problem is central. It's up in the brain. But with something called AVP resistance, or AVPR, the signal is sent out perfectly, but the problem is at the destination. The kidneys just can't respond to it. You get the same symptoms, but the root causes are totally different and need different treatments.
So the classic way to figure this out is something called the water deprivation test. And yeah, it's pretty much as intense as it sounds. Doctors will very carefully restrict a patient's water intake to safely dehydrate them.
This is designed to force the body to try and concentrate urine on its own. Then, once the patient is dehydrated, they give a dose of synthetic AVP. This is the moment of truth. They watch to see if the kidneys, now that they have the signal they were missing, will finally wake up and do their job.
And the results from this test are just so clear. In a patient with AVPD, their urine stays super dilute during the whole water restriction part. But the second you give them that shot of synthetic AVP, bam, their urine concentration shoots up by more than 50%. It's definitive proof. The kidneys work perfectly, they were just waiting for the command. If there's barely any change, you know the problem is with the kidneys. They're resistant.
Now, that water deprivation test is pretty tough on patients. Thankfully, science has come up with a better way. There are newer tests that can directly measure a little marker called copeptin, which is a perfect stand-in for AVP release. This test is way faster, way more comfortable for the patient, and best of all, it's incredibly accurate at finding the real cause.
Okay, so the fault has been found. The AVP signal is officially missing in action. The solution, then, is actually pretty logical. We just need to give the body a replacement signal.
And that replacement comes in the form of a medication called desmopressin, also known as DDAVP. It's a synthetic version of AVP that does the exact same job. It goes to the kidneys and tells them to hold on to water. And just like that, it restores the body's balance.
And what's really great for patients is that it's not a one-size-fits-all treatment. It comes in a bunch of different forms. It can be a simple pill, a liquid, a nasal spray, or even an injection for urgent situations in the hospital. This means the treatment can be tailored to fit each person's life and their specific needs.
Okay, but, and this is a huge but, there is a critical safety issue here. Desmopressin forces the kidneys to save water. If a patient keeps drinking huge amounts of fluid, maybe just out of habit from before they were treated, they can seriously dilute their blood's sodium levels. This is a dangerous condition called hyponatremia. So the #1 rule for patients is this: once you're on the medicine, you only drink when you are actually thirsty, not just because you're used to it.
So what does life look like for someone with AVPD in the long run? Well, with the right treatment and proper follow-up, the outlook is actually really good.
The long-term prognosis is excellent. With desmopressin, people can lead completely normal lives. The real key is just consistent management and follow-up. That means regular checks for other potential pituitary hormone issues, very careful management for those rare patients who also lose their sense of thirst, and sometimes keeping an eye on the brain with MRIs to make sure nothing changes.
So we've gone on this whole journey. We've seen how this elegant hormonal system works, what happens when it fails, and how we can use science to create an elegant synthetic replacement. We now know we can successfully replace that missing signal and bring everything back into balance. But it leaves us with one final big question to think about. What does the future hold for actually preventing the initial damage that causes this signal to be lost in the first place?